provincial health officer here in British Columbia, and I'm grateful to be here today on the traditional homelands and waters of the Lekwungen-speaking peoples, currently the Songhees and Esquimalt First Nations here in what we call Victoria. Today I'm here to provide an update on the young person in BC who was infected with H5N1 avian influenza, and to give you the results of our extensive public health investigation that we've conducted over the last few weeks. So this is a follow-up from the briefing 2 weeks ago, just after our laboratory surveillance had identified our first case of H5N1 locally acquired in British Columbia. First and foremost, the teenager who developed a rapidly progressive severe respiratory illness remains in critical care at our tertiary pediatric hospital, BC Children's Hospital in Vancouver. This young person has received the best possible care from the clinical team at BC Children's and is stable, though still very sick. Our thoughts remain with them and their family, and we remain hopeful as they have made some progress in the last few days that they will recover from this very severe infection. At the last briefing, I outlined the steps in our public health investigation. We are in the very critical phase of determining if anyone else was sick with this virus from this very rare infection in humans, whether from the same exposure that this young person had or from contact with this young person while they were sick. So contact tracing, as we call it, identified initially around 60 healthcare workers who may have had some exposure to the young person during the times they were in hospital and several hospitals. And at the end of the day, there were 34 healthcare workers who had some exposure during the time that this person was sick. All of those healthcare workers have now been through what we call a 10-day incubation period. They were monitored, tested if they had any symptoms, and all of those results have come back negative. In addition, there were 16 close family and friends that had been around this young person during the time when they were infectious, and all of those people have been followed up, offered prophylaxis, and have had daily follow-up with public health. In addition, we have done an extensive investigation. I'll give you some more details, but the overall numbers, there were over 25 animals, birds, rodents, dogs, cats, reptiles that were investigated and tested, and we did 10 different environmental samples from different areas around the home and other places, including water, sediment, and wastewater. All of the people and pets and animal owners were contacted individually. Their risk was assessed, and they were offered prophylaxis and testing as needed, and followed up individually for 10 days after each potential exposure. As I mentioned, all of the human contacts have completed 10 days, and we have identified no additional cases of H5N1. We are ongoing in monitoring of the close family members who continue to spend time with their young person in hospital. Multiple tests were done in many different species of animals, including one potential source of the exposure to this young person, which was a pet dog, which was sick at the time of the onset of illness of this child. And I want to express my appreciation to the Chief Veterinary Officer, Dr. Teresa Burns, and her Animal Health Center team. This dog was thoroughly investigated with every test possible, and we consulted with colleagues across Canada and the US. There have been only 2 known cases of canine H5 in the world, and so there is a lot we don't yet know about how this virus might present in a dog. Having said that, all of the additional testing that was done, including samples from many different parts of this dog, all of them have been negative for H5 influenza. The investigation of this dog led to additional follow-up at a vet clinic where the dog was assessed, and at the home where the dog had been prior to being adopted by the family of the teen. All of the humans and other animals in these places have also tested negative for H5. So many hours of detailed investigative work by primarily our Fraser Health public health team has, and I can't stress enough how important and thorough this work has been over the last 2 weeks. And it has taken a lot of our time over every day in the last few weeks. It also included site visits to the home environment in the area around the home and the school. And I have to reiterate that there was no exposure once this teen had symptoms to anybody at their school, but we needed to look back and see if there was an exposure, a common exposure that might have happened while they were at school prior to getting sick themselves. And we have not identified either a common exposure or anyone else who has symptoms in the school environment. As I mentioned, there were a number of environmental samples taken of water, sediment, and wastewater, and these have also all been negative for H5. Part of our investigation involves advanced laboratory testing, and when we talked 2 weeks ago, we had just initiated that process, and we have the ability at the BC CDC Public Health Laboratory to do the H5 testing, and then that was confirmed at the National Microbiology Laboratory in Winnipeg. And the Public Health Lab team also were able to identify what genotype of the H5N1 the young person was infected with. So we were able to do what's called whole genome sequencing, and some people will remember from our briefings around COVID that this was an important tool that allowed us to understand where different strains of the SARS-CoV-2 virus were coming from and how they were being transmitted between people. So this same technology has been developed at the BC CDC Public Health Lab, and we were able to determine that this virus was a clade B 2.3.4.4b, which sounds kind of technical, which it is, and also that it was a genotype D1.1. And this is important. This is important because this clade and genotype is the same one that has been detected in wild birds here in British Columbia through our surveillance partnership, our One Health approach with the Animal Health Centre, and also in the many poultry outbreaks that we're experiencing here in premises across particularly the Lower Mainland. And there are now up to 54 premises, and mostly in the Fraser Valley, that has been devastating the poultry industry. What we can tell from this clade and genotype that it is not related to the dairy cattle in the US, which has a different genotype. It's B1.13. We wanted to have additional information to help us understand what this virus in this young person was most closely related to. So we have a unique group of scientists at the BC CDC Public Health Lab that allowed us to plot the virus in this teen on what's called a phylogenetic tree to see which genome it most closely was related to. And the closest match was one taken from a virus found in wild birds in the Fraser Valley, particularly 2 geese that were detected in wildlife that were tested earlier in October. So that tells us a lot. It helps us understand where the potential exposures might be. And it wasn't a direct match, so that tells us as well that there may have been an intermediary, either another bird or an animal, between the geese that were detected and this young person. But very importantly, it also tells us that this genotype was quite different from what is causing the devastating outbreaks in the poultry industry. So we had no evidence from speaking to family and friends that this young person had been near poultry farms or that there was any concern about that. And this genotyping helped us understand that it was quite distant from the poultry outbreaks that are happening. So that's been quite exciting and important for us in helping to narrow down our investigation. Some people will know that this genome was posted on an international website where genomes are posted so that other people can compare and understand where they come from. It's called GeeseAid. And that also helped us understand that the virus that is infecting the young person here is quite different from the human cases in Washington state. Also, in having scientists from around the world being able to look at this genome, there was identified some mutations in the virus that may indicate adapting to humans. So this is something that we need to investigate more, and our scientists at the BC CDC Public Health Lab, at the BC CDC, who have experience in this particular influenza team, led by Dr. Skowronski, have been working with scientists from around the globe to understand the implications of that. But it also is really important to us to see, well, was this a mutation that had led to this young person becoming infected, or was it something that may have led to them having more severe disease than we've seen in other people who've been infected with H5N1, particularly in North America? So right now we know that this is an influenza virus. It's an influenza virus of birds that has been spreading very rapidly in birds. But more humans being exposed to this could change, the virus can change and adapt to be more able to infect people or pass from person to person. So one of the reasons we did this so detailed investigation was to ensure that there was no evidence, and I can say that again, there is no evidence of transmission from this young person and no evidence of any other cases right now in British Columbia. In the US, there have been 55 cases identified this year, mostly in dairy workers who have had contact with infected dairy cattle or milk. And mostly they have been very mild cases, and they tend to be in older adults in 7 different states across the US. You may also know that very recently there was a child in California who was identified with H5N1 for whom we don't yet know what their exposure was. Also, very importantly, in the US, they detected just this week positive samples of H5N1 virus in raw milk, so unpasteurized milk that was being sold. And so it is a warning to us all that this virus can cause quite severe illnesses and can be found in places that we may not have thought of in the past. I will note we have not found H5N1 in dairy cattle in Canada or in milk samples in Canada, and the Canadian Food Inspection Agency has a sampling program across the country that has been looking for that. So where does this leave us now? As I indicated at the start, the young person who's infected is still in critical care, so we are not able to talk to them directly about where the exposure might have happened. Their family and friends have been incredibly generous with their time and, of course, anxious themselves to try to understand how this happened. But as I also mentioned the first time we talked a couple of weeks ago, in the absence of being able to talk directly to this teen, we may not ever know for certain exactly where they were exposed and where it came from. This is not unheard of. In the US, there have been cases identified last year in Missouri where, again, there was no contact identified, there was no source identified. And as I mentioned most recently, this child in California. So our investigation, our detailed public health investigation, is closed for now unless anything new arises. And I am very confident that there are no additional cases out there right now. But we still need to be careful, and we need to watch and think about how do we prevent this from happening to anybody else. As I mentioned, this virus is moving around the world in migratory waterfowl. So that's ducks and geese that migrate north in the spring and south in the fall. And we're along what's called the Pacific Flyway here in British Columbia, particularly the lower mainland, but it covers the entire province. And we know that this is the highest risk period of time, and in particularly November and into early December, when the ducks and geese are coming down into this area of town, or of the province. And since 2022, This virus, H5N1, has been found and has been causing outbreaks in backyard flocks, in poultry particularly, and we've detected it in wild birds. And the very first one that was detected was actually a raptor, an eagle in Vancouver. And when an eagle is sick, people tend to notice them, and it was tested and it had H5. So this is the 6th season that we've had these migratory waterfowl leading to outbreaks in that there is a lot of this virus in ponds and marsh areas where these birds live for the season. So that's important for us to recognize as well. So what can we do? Critically, it is especially this time of year, avoid sick animals and birds, and you can report wild birds. We have numbers and it's on all of the information that I can provide to you. But we also want to make sure we keep pets away from birds, but also from ponds and areas that they might want to go into right now, because we know that ponds that have ducks and geese in them right now can have virus in the water that lasts for some time because of the droppings and the feces from the birds. Don't handle ducks or geese or poultry at this point in time in places like petting zoos during these high-risk periods. And I understand that ducks and geese don't like to be handled anyway, but we do know that it's some of these farm visits where chickens are handled by young people. This is not the time to do that because we know there's a risk from these migratory birds. If an area with bird droppings, if you're in an area with bird droppings, or if you're handling pets that have been outside, ensuring that you wash your hands frequently after touching pets or any of the areas. Other things that are important for us to do, get the updated influenza vaccine. This year, the vaccine has H3N2 and H1N1 in it. And those are human influenza viruses that we're seeing circulate. We're starting to see a little bit of an uptick of influenza causing illness now. And as we head into the holiday period, we expect we'll see more. And though the H1N1 is different from the avian version of the H5N1, there is some research that indicates that we may have some protection by getting that vaccine with the N component that is the same. We also want to get our updated COVID vaccines and make sure that we're doing the healthy habits that keep us all safe. Things like washing our hands, covering our mouth when we cough, staying away from others when we're sick. We want to make sure that we're not sick so that as we head into the holidays, we can enjoy them with our family and friends without worrying. I also want to just make a comment about, we are very aware of the pandemic potential of avian H5N1. The more humans that are exposed to this virus and the more other animals, particularly other mammals, and we worry a lot about pigs, as I mentioned last time, there's an increased risk that the virus might change and become more easily transmitted from person to person, or that somebody can be infected with both of the viruses at the same time. So far, this H5N1 virus, the avian flu virus, does not seem to transmit to people very well. And we know that because we've had, as I mentioned, over 54 now outbreaks in poultry farms where their poultry workers and the people who are euthanizing the birds that are infected have been exposed to high doses, and they do wear personal protective equipment, but we have not seen any infections here in British Columbia this year. And a very small number, despite large numbers of people being exposed in the United States to birds and also to dairy cows. So those are things that are reassuring. And this virus has, as I mentioned, been around for several years now. But this case reminds us that there is always that risk, and we need to be vigilant for that, and we need to take those measures that protect us individually and as a community. And from my perspective in public health, we will maintain our important and robust surveillance that picked up this case in the first place, and ensure that we have both our wastewater surveillance and the surveillance that we have in healthcare settings to be able to detect these early. I also want to talk about our partnership with our animal health colleagues and the wild animal vets that we work closely with to monitor what's happening in species other than humans across this province. These are important safety nets that help us understand what's happening in our environment, what's happening with the wild bird population, and that can affect what happens here for the human population. Finally, just if you are sick, make sure you're staying away from others and trying to prevent transmission of those infections. And if it doesn't get better, or if you have persistent fevers, if you have symptoms that get worse over time, any signs of difficulty breathing, then please go seek medical attention. And we are there to make sure that that can be done safely anywhere in British Columbia. Thank you very much, and I'm happy to take any questions.
It's now time for questions from media, beginning in the room and then phones. For media on the phone, a reminder to press *1 to enter the queue. You'll be able to ask one question and one follow-up question. We'll go first in the room to Kylie Stanton with Global News. Kylie, go ahead.
Hi, Dr. Henry. Thank you. Can you tell us whether or not this individual, this teen that's been infected, if they had any underlying health conditions or any problems that would create such an illness? They appear to be very, very sick. So is there anything you can tell us about pre-existing conditions that may have led to this?
This was a young, healthy person prior to this, so we have no underlying conditions that affect their immune system that we're aware of, no. So it is a warning sign to us, and if we look at there's about 900 cases globally of H5N1, and we do see that younger people tend to have more severe illness, and it may be that as we get older we have some exposure to different influenza viruses with particularly the N1 part that might give us some protection from that severe illness. So that's one of it. The other thing is, and the scientists who know way more about this than I do are looking at the genome. And as I mentioned, there's been some mutations that are concerning. And one of those is one that may have led to the virus being more easily able to bind to the receptors deep in the lung. And that means they're more likely to have more severe illness. So those are the questions that are still unanswered, but certainly give us an idea of why this person has more severe illness than we've seen in others.
And follow up, you mentioned a case in California, a child as well, that with the virus apparently adapting and mutating. What are the concerns around that in terms of, seeing more cases coming up here? You mentioned the word pandemic, which might be a bit triggering for some people. So can you
Myself included.
Can you speak to that a little bit in terms of the adaptation you're seeing and the concerns about, these cases popping up in such close proximity to BC?
Yeah, and this is if we think about the wild birds and the amount of virus that's in wild birds, the fact that we've seen a single case acquired in Canada over the last number of years tells us it's a rare event. And that's reassuring. And my job was to make sure that there was no other cases out there when this rare event popped up on our surveillance system. So they're going through the same thing in the US. So again, we haven't seen the whole genome sequence yet, so we don't know if there's a reason or what it's related to, whether it's closer to poultry or to dairy cattle, for example. But as I understand it from colleagues in the US, there's no known exposure yet, similar to what we see. So again, another rare event, and the important thing will be seeing if there's any transmission around that event. So even if there was this mutation in the virus in the young person here, right now that would have died off because we have not seen any other transmission. So that's reassuring. But it just reminds us in the back of our mind that the influenza virus can change quite rapidly. And so we need to be on our guard. We need to have robust surveillance to be able to detect these things early, and our public health teams to be able to find and manage and control it before it could potentially get out of hand.
Okay, we'll go to the phones next. First to Yvette Brend with CBC. Yvette, go ahead.
Yes, I'm really curious, as a parent, I know a lot of people will be wondering, is it potentially possible that this teen came into contact with just, say, goose poop or something, or perhaps the dog did and the test just didn't show up in the dog because of the time lag between when the teen presented? I mean, is there a possibility that this could be as simple as that?
Yes and no. So we investigated the dog in a lot of detail, including exactly where it had been, if it had ever been outside in an area where there might be exposure. Our consensus, though it's very challenging, is that there's no indication that this dog had H5N1. Yes, we know that most exposures to things like avian influenza can come from handling sick birds or from handling the feces and the droppings, particularly if they're in water and brackish areas. We detect it there. But we also know that it's very rare that it's actually transmitted to people. So the things that we can do to protect ourselves from that, or if we do come in contact with, pets that are messing about in muck, as they do, or if we get our hands dirty with that, just to clean our hands. How we get infected with it is by inhaling the virus or rubbing it into our eyes. So those things that are really important for us to remember, we can prevent that and all the other things that are in the environment by cleaning our hands regularly, making sure we're not rubbing our eyes with dirty hands, cleaning our hands before we eat or put things in our mouth. And so those are the important basic messages that make a difference. And if we see, I think about you go walking in the park very close to here and there's goose poop on the ground. It doesn't last. The virus doesn't live outside the body of the animal or bird for very long when it's out in the environment by itself. So the risk is not so much small doses in the environment, but yes, it could possibly have been transmitted by an animal that ate or bit a wild bird that was sick with it, and then somehow an inoculum got either into the eyes or into the nose and throat. But I just want to emphasize how unusual that is, because this virus has been circulating quite a lot in wildfowl for a long time, for several years that we know of, and this is the first time it's happened. So it's still a very rare event, and those basic things that we can do, protecting ourselves by being vaccinated against the human strains and cleaning our hands regularly and being mindful about that, and do well to protect us. And I talked a little bit about people who have very high exposures, like people who are working in the poultry barns that are infected, and we still don't see transmission very frequently. So it's a rare event, and the simple things that we need to do to keep ourselves healthy will make a difference in preventing this as well.
Yvette, did you have a follow-up?
I did. So this teenager, it sounds like there's been some improvement. This person is getting attention around the world. There was a New York Times piece today concerned about this. I mean, there's been 55 cases in the U.S., but most of them are very mild. How concerning is this to you that this has been so serious for this teen?
Yeah, obviously it's concerning, but if we look at, as I mentioned, in Southeast Asia, Indonesia, Vietnam, other places where this virus is circulating, the case fatality rate in children can be as high as 50%. So they do get severe illness. And what made it so severe in this young person is a combination of things, perhaps the amount that they were exposed to, and as I mentioned, there's ongoing discussion with the scientists about whether some of the mutations that developed made it, it started with a conjunctivitis, so infection in the eyes, and then progressed over several days to a very severe, rapidly progressive severe lung infection. So could the virus have changed in their body even to be able to bind to those receptors deep in the lung and cause that more severe illness? So those are the things that are now in the realm of the scientists looking at this over time and trying to understand better. But obviously it's concerning anytime, particularly a young person has a severe illness like this.
The next question goes to Michelle Bernaro with CTV News. Michelle, please go ahead.
Hi there. Thanks for taking my question. Sorry, I'm just trying to get clarification, firstly, on what Dr. Henry was just saying. When you were referring to this starting in the eyes and then moving, are you talking about this, the case in BC, or are you talking about another case?
No, the case in BC, their initial symptoms was conjunctivitis.
Okay, thank you. And I know you've touched on this, but you talked about how many farms are now infected right now. Given how much this has spread and how this particular time of year is, we see more of this. How concerned are you that we'll see another case in BC?
Yeah, it's really difficult to say. We have an N of 1, in the last number of years. It does remind us that this virus is out there, that it is in the environment, and it's particularly this time of year. I think globally, the animal bird community and the public health community have been trying to understand those risks and the risks of spillover into humans. But we work very closely with the Canadian Food Inspection Agency, the poultry industry, to make sure that workers are monitored who work on these poultry farms that are affected, and particularly the ones where there's lots of virus in the environment. We know in these chicken barns, for example, where the chickens are infected, they get quite sick themselves, and it's shed in the droppings from the birds. So there's a lot in the environment, and we work with the producers and the workers there to make sure that they're wearing appropriate masks and goggles to protect their eyes, but it's not perfect, and not every having to wear that and work in the environment is challenging. So despite that, in those very high virus environments, we have not seen cases in workers. Sure, there's probably a few asymptomatic ones, and we saw that from some of the data from the US around dairy cattle in particular, or dairy cows. So right now, this virus does not seem to spill over into humans very easily. That's the good news. But yes, we need to continue to monitor to make sure that we're catching every case that potentially happens, and that we're able to assess the risk and ensure that the virus isn't changing.
Next question goes to Wolf Deppner with Black Press. Wolf, please go ahead.
Yes, thank you for taking my question. Dr. Henry, you said earlier that the detailed public health investigation has closed, but you also acknowledged that you haven't had a chance yet to speak to the teenager. In light of those two facts, how appropriate is it to close the investigation right now if you haven't had talk to the key figure in all of this?
Right. So what I said was that the investigation is closed for now. There's no further leads, and we've been extensively looking for concentric circles of people who might have had contact with somebody who might have had contact, or animals who might have had contact. And there's no further leads right now, and there's no further indication of transmission. So our investigation has come to a close for now. And absolutely, if this young person recovers, which we absolutely hope they do, and we have an opportunity to speak with them, we may be able to get more information, but that may not be possible. We don't know if they'll be able to remember things that happened prior to. So unless something changes, we won't be continuing. There's no leads that we need to follow up on right now. There are a few family members that we will continue to follow. And as I mentioned, this is a reminder to us of how important our surveillance system is for being able to monitor what's happening in the population. We'll be continuing to look at the wastewater in different areas around the province to see if we're picking up H5. And with the amount of virus that's in the environment right now, that's going to be incredibly important.
Wolf, did you have a follow-up?
Yes, I do, and thank you for that clarification about the timing. I appreciate it. A question regarding the state of this individual. Obviously, there are privacy concerns involved here, but you mentioned that authorities haven't been able to speak to this individual yet. So can you give the public sort of a sense of this person's overall condition? Could you also comment on this person's ability to recover, and what, if any, long-term consequences, health consequences might this person experience from the situation? Thank you.
Yeah, many of those are unknown. The young person is in critical care. They are not breathing on their own. So the information that we have comes from their family who've been with them, and from the care team that have been providing care to this young person. So there were some positive signs, as I mentioned, over the last few days, and we remain very hopeful. We're sending all of our thoughts to this young person and their family, and we hope that they'll be young people. Teenagers are very resilient, and they can recover from these types of very severe infections way more than older people. But there's a lot we don't yet know, and the clinical care team doesn't know yet either. So that is unfortunately an unknown for us right now.
The next question goes to Alana Smith with the Globe and Mail. Alana, please go ahead. We can't hear you, Alana. Can you try again?
Can you hear me now?
Yep. Go ahead, please, Alana.
Oh, thank you. Sorry about that. I was just asking, so there's a retired virologist, Henry Neiman, and he speculated that there may be a second avian flu case in BC linked to another mutation, H275Y. Just wondering if you have any information about this, or if you're investigating possible cases related to that mutation.
Yes, I think he's got one thing wrong. It's not a human. That was this mutation was identified in a bird, and yes, we have ongoing work with our animal health colleagues around identifying where that came from, who's been in contact, which premises are affected, and whether there has been any further onward transmission of that. So far, there's no humans involved that I'm aware of.
Alana, did you have a follow-up?
Sure. I just wanted to ask a little bit more. I know you had spoken earlier about the possibility that, or there's this risk, right, that it could become a pandemic. I'm wondering, are there any sort of preventative work that BC is doing specifically because of this case of the BC teenage to ensure, that it doesn't get to that there aren't more cases here in BC?
Yeah, so I talked a lot about our surveillance that we have in place. And so for this investigation, we did very detailed investigation and went beyond just the contacts of the individual. We went to people who might have been contacts of a contact, which is not usually an issue. But because this is such a rare event, we wanted to ensure that there was nothing out there like other people who might have had a common exposure, and there is no indication of that. So the laboratory testing is very helpful in that regard. We haven't seen anything that would indicate there's any other cases of H5N1 in BC right now. But what we do need to do is monitor this. And I mentioned last time that one of the things that we were concerned about was the identification of H5N1 in a pig in Oregon. And so we have had outbreaks in some petting zoos and small hobby farms where there have been multiple animals, not just birds. And so, yes, we were very cautious about that and work closely with, again, our animal health colleagues about testing other mammals. And we have found it in some other mammals. So we did very broad testing of any animal that was in the radius of both the pets in the family home or that this person might have been in contact with or their family in contact with. So those are the things that we do to make sure that it's not hiding somewhere in that we didn't detect. And so far, everything has come up negative. But it is worrisome. It's worrisome when it, particularly pigs and influenza people will tell you this. They can be what we call mixing vessels, because they can be infected with human strains as well as avian strains. And sometimes the genetic code for influenza has 8 small genes, and they can swap and change quite rapidly if they're in the same person, or in the same animal. That's the other reason why it's so important that I'm talking about the importance of getting your influenza vaccine this year. We know this is out in the environment. It's not causing illness in most people, which is good, but we don't want to take that chance of somebody being infected with a human strain and with an avian strain.
The next question goes to Helen Branswell with STAT. Helen, please go ahead.
Hi, thanks. Can you hear me?
Yes, go ahead, Helen.
Oh, great. Thanks so much for taking my question. I think Dr. Henry has alluded to this in her overall message about finding no additional cases, but I know you were doing serology, and I'm wondering have you received all the results back on all the people whose blood you tested?
Not all of the results yet, but of the results that have come back, the initial results have all been negative, and obviously we're continuing to follow, particularly some of the family members who have ongoing contact with the young person in hospital.
Helen, did you have a follow-up?
Yeah, just quickly, I understand the need to be careful about releasing information that might identify this child. But you mentioned that there are 54 premises in the province, mostly in the Fraser Valley, that are battling H5 at the moment. Geographically, does this teenager live anywhere near any of them? I mean, does it? Well, actually, you said that the virus isn't associated with the poultry outbreak, right?
That's right. The phylogenetic trees really link it to wild birds, in particular 2 specific cackling geese that were tested earlier in October. So most closely related to that. And if we look at the phylogenetic trees, the genetic changes that we see in wild birds are quite different from what's in the poultry that's been infecting the poultry. So there's no link at all that we can find between the poultry farms and this young person.
The next question goes to Mike Stobie with the Associated Press. Mike, please go ahead.
Hi, thank you for taking my call. First, Dr. Henry, thanks for doing this. Just wanted to clarify. You mentioned about a mutation that suggests it's adapting to humans. Did you mean the mutation that allowed it to bind to receptors deep in the lungs? Is that what you were referring to?
Well, there are several mutations, and this gets into the very detailed genomic analysis that is ongoing. So there were several mutations around, one of them was particularly around the receptor binding area. And in previous influenza strains that have adapted to become more easily spread to humans. And we think of H3N2 and the 1918 pandemic. That's been an area that has led to adaptation to be able to spread more rapidly between people. There's also a mutation that might indicate that the virus is more easily able to attach to receptors that are deeper in the lung. We have receptors that influenza viruses attach to in our eyes and our conjunctiva and the back of the nose and the back of the throat. That's how most people get infected. And most of us with influenza don't get very severe deep lung infections. But if the virus receptor binding area can change to recognize those receptors deeper in the lung, that increases the risk of having some more severe illness. So none of this is set in stone yet. These are things that the scientists are looking at in detail, at the way the receptors are changing. We have serial samples of the virus from this young person to see if it's changed over time while they're receiving treatment. For example, will they develop resistance to some of the antiviral drugs? So these are all more in the clinical research realm to help us understand perhaps why this young person became so ill, and also to help us in the future to guide things like treatment. So it's a complex world, and I certainly don't have all the answers, and I know the scientists are really looking into all of these different genetic changes, and they're very small changes, and what they might potentially mean.
Mike, did you have a follow-up?
I have a follow-up. Yeah, I do, if I could. Well, thank you. Could you talk about the risks that this virus from this teenager could spread to others? Is the teen in isolation? What are the precautions that are in place to prevent other people from moving forward, even if no infections have been identified up till now, moving forward? And also, I think you mentioned a school. My recollection from the previous press conference was the teen hadn't been in school, but had the teen been to school recently? Thank you.
Okay, so the second question first. And I thought I made that clear, but I will again. The teen was not in school during the period they were infectious to others. What we need to do is determine we went back as far as 21 days prior to their symptoms starting to see if we could identify where they were exposed. So what was the source of their infection? So inevitably, we needed to look at the school. Were there anybody else in the school? Were there any other things that they might have done around the school that would have indicated a source of infection? So all of that has not given us any ideas about where they might have been infected, and we've not identified anybody else who might have been exposed to a common source, for example. So that's the school, and you're absolutely right. There was no exposures from that the young person, the teen, in the school when they were infectious to others. And this illness progresses over time. So yes, we are continuing to follow the healthcare workers and the family that have had ongoing exposure, but this person is in airborne isolation in the hospital. So there's very limited number of people, and they wear personal protective equipment and are being followed up and tested regularly. But one of the things that happens over time is people clear the virus, and so they're at the point now where they're no longer infectious to others. So that's important too, and that's why we can say with some confidence that it's a dead end right now, in that there's not anybody that's been identified as being infected related to this young person. Some of the family members and the healthcare workers are still within that 10-day incubation period, but we're continuing to monitor them, and they're wearing personal protective equipment and taking precautions as well to ensure they don't get infected.
The last question goes to Michelle Gamage with the Tyee. Michelle, please go ahead.
So I heard you mention cackling geese. I'm wondering if you could just clarify, when we say that this virus didn't come from chickens, but it came from a goose, are we talking about Canada geese? Are we talking about snow geese? Are we talking about cackling geese? Do we know?
Yeah, so I didn't say it came from. The thing about genetics and the whole genome sequencing is we only know from the birds, in this case, that have been tested. And we know there's also been cows that have been tested. There's been skunks and foxes and a few others, wild animals. And we put it all on a tree, and we try and look at, which ones are they most similar to. So it's not the same, but it's closest to a pair of cackling geese. And I'm sorry, but I don't know all the nuances between different geese species, but that were found dead and were tested in the Lower Mainland in early October. So it's not exactly the same, so we don't know that it came directly from them, but it gives us a sense that it was closely related to the wild birds, not to the poultry farms, because we sequence the virus in the poultry farms, and they have genetic differences that make them, we call it like a family tree. So they're more distant cousins as opposed to maybe first cousins. So the whole genome sequence of this young person was closer to the wild birds, and particularly these geese that were found in the Lower Mainland in October.
Michelle, did you have a follow-up?
Yeah, just wondering if you could weigh in on like best practices, or if you have a dog that does maybe get off leash and runs off and eats some goose poop or jumps in a pond. Dogs sometimes get away and do that. Is the best way to kind of approach, I don't know if I want to call it decontamination, but like, should you just make sure to shampoo your dog, wash your hands, or do you need to be taking care to like wear a mask or when you're doing that?
I think you said it just there, the usual things that you would do, but ensuring that, kids probably aren't around them, that you clean them up and that you're careful about it, that you wash your hands. And we say this all the time too, making sure you wash your hands when you feed pets or when you're petting them. And if the dog, in this case, gets sick, to take them to the vet, to keep children away from them if they're sick, to have them assessed. So dogs, we don't know a lot about influenza in dogs. We know about influenza in cats a little bit, but they can get sick with other things from eating feces and being in ponds and things like that too. So making sure that you keep children away from them if they're sick, cleaning hands regularly, and cleaning them off when you come in from being out in the mud.
Thanks everyone for your interest, and that concludes our press conference for today. Have a great day.
Thank you very much.